Today I will be discussing the NuvaRing, a choice in hormonal contraception that is available by prescription only and is available for anywhere from $0 to $80 dependent upon income or insurance. The NuvaRing is a small, flexible ring that is inserted into the vagina to help prevent pregnancy. It is about 2 inches in diameter, and as you can see here, it is able to fit into the palm of your hand. Once placed inside of the vagina, it lasts 3 weeks and continually releases low doses of hormones. However wonderful in protecting against pregnancy at about a 98% rate, it does not protect against STIs, sexually transmitted infections, or STDs, sexually transmitted diseases. Therefore, you should always use a method of barrier protection, i.e. a condom, female or male, in conjunction with the NuvaRing. The NuvaRing is placed inside of the vagina via a position of comfort as shown in the top picture, either laying down, squatting, or on a leg propped up, or sitting on the edge of a stool. It is inserted into the vagina by pinching with the index and the thumb and inserting it with the index finger into the vagina up as far as it can be reached. And don't worry, most women cannot feel the ring once in place. If you do happen to feel it, it could be that it's not pushed up high enough into the vagina. Removal of the NuvaRing is quite easy. First, you must wash and dry your hands. Then, get into a position of comfort. Slide your index finger into the vagina just far enough to be able to hook your finger around the NuvaRing. Then gently pull down and forward and pull out of the vagina. This is easy to just dispose of into the trash. If you kept the foil pouch from your previous ring, you may put it in there, seal that up, and throw it away. So I know some of you are probably wondering how something thin and flexible and inserted into the vagina can work as a form of birth control. Well, as previously mentioned, the NuvaRing does consist of low dose, continuous flow of hormones. The 2 hormones that are directly involved with the NuvaRing are also what are found in birth control pills, estrogen and progestin. As most of you know, hormones are like chemical messengers that are secreted from different places in the body that communicate with our brain, letting us know what to do and what not to do as far as chemical reactions are concerned. This is involved in menstruation. So, estrogen and progestin, these 2 hormones, keep the eggs from leaving the ovaries. As you probably know, pregnancy cannot happen if there is no egg to join the sperm. This also makes the cervical mucus thicker that keeps eggs from the sperm, rather the sperm getting to the eggs. Because the ring works like the pill, it is at an effective rate at 98%. This is also thought to be advantageous in protection against certain health conditions such as acne, bone thinning, bad menstrual cramps, breast growths that are not cancer, cysts in the breasts and ovaries, ectopic pregnancy, endometrial and ovarian cancers, heavy and/or irregular periods, iron deficiency anemia, pelvic inflammatory disease, which often leads to infertility when left untreated, premenstrual symptoms, including depression, headaches, serious infection of the ovaries, tubes, and uterus. Because it has an effective rate at 98%, according to Planned Parenthood, this number is derived from 1 in every 100 women will get pregnant when using the NuvaRing as directed 100% of the time, and 9 in 100 women will get pregnant using the NuvaRing when they do not use the NuvaRing as instructed every time. So, I can definitely say that this is effective and advantageous to its user. Along with the advantages come some disadvantages and risks. The NuvaRing does not protect against AIDS, HIV, or other STIs or STDs. Using the NuvaRing may cause a woman's sexual desire to change. Using the NuvaRing may increase the incidence of infections such as urinary tract infections, bladder infections, yeast infections, and, if untreated, kidney infections. Women using the NuvaRing may also experience bleeding between periods, and in very rare cases, the disadvantage may be that it can be fatal. Other rare risks include developing high blood pressure, liver tumors, gallstones, or yellowing of the eyes or skin, which is known as jaundice. The risk for these problems increases if you are age 35 or older, are very overweight, have certain inherited blood clotting disorders, have diabetes, have high blood pressure, you smoke, have high cholesterol, or need prolonged bed rest.